Your predecessor, Andrew Scheer, was asked a number of times if he trusted the advice of Dr. Tam, and he never gave us a straight answer. So I'd like to get your opinion. Do you trust the advice that Dr. Tam gives Canadians?
Yes, I do, Mackenzie. And in fact, every briefing, every chance I've had to be briefed by Dr. Tam, I've thanked her and the Health Canada team for their work throughout a pandemic. All Canadians have been working incredibly hard, and people in public health offices and our frontline healthcare workers have been working extraordinarily hard. The bad decisions on partnering with China, for example, the CanSino project, we lost 5 months of time. That was not a decision by a civil servant. That was a decision made by Mr. Trudeau and his cabinet. The fact that we didn't push for rapid diagnostic approvals using our CETA trade agreement as a template, for example, that was a political decision. So the slow and confused response, the fact that they won't publish a plan for our vaccination schedule in the new year, that is Mr. Trudeau. And so I appreciate the work done by public health officers and our civil service throughout this pandemic. The poor decisions and the slow response is the politicians, and I will hold them to account.
In the petition that Mr. Sloan brought forward, there was one passage that stuck out to me. I want to get your opinion if you agree with this. It says that bypassing proper safety protocols mean that COVID-19 vaccination is effectively human experimentation. Do you think in any way that a vaccine is human experimentation?
Well, vaccines have a clinical process, Mackenzie, for approval. And I was just speaking with a Canadian company last week, entering in the next month into phase 3 clinical approvals. This is why we need a plan. These approval processes could demonstrate confidence in Canadians' approach to vaccines. There is some vaccine hesitancy out in the public at large. That's why we need to show, here is the plan, here is the testing, here's the clinical data, here's its safe and effective use, here's how we're going to keep it at minus 70, and here's the likely time frame you will receive it. We should be telling Canadians that. Why the government's being so secretive, it's actually adding to a lack of confidence in the process.
Lee?
Yes, sir. Lee Berthium, Canadian Press. Good to see you. Just to kind of follow up on that, there is a constituency of people in this country who do not trust the science behind the vaccine. Pollsters have identified many of these people as likely to vote for your party. Again, do you have faith in Health Canada's protocols? If not, why not? And what is your message for those people who do not have that faith?
Well, thank you for the question, Lee. I have very great confidence in our process. And in fact, in the private sector, I did some work on healthcare regulation as a lawyer. And I'm happy to talk to Canadians on the importance of a vaccine, why it's important to get vaccinated, how our clinical peer-reviewed process for testing can give them certainty in the process. And let me correct you. In fact, the vaccine hesitancy is quite similar between the three parties. In fact, if you look at the CBC, Mr. Grenier's poll last week, there's not that much discrepancy between, say, the NDP supporters and Conservative supporters. This is why a plan is so critical, Lee. We need to tell people what tests there have been done, how the clinical trials went, how they can be applied safely, how it can be stored safely. Information in a pandemic is a critical tool, and the secrecy of the Trudeau government is leading to more uncertainty, more confusion, a lack of confidence at a time where we're seeing Christmas celebrations canceled. We need a plan. I hope the government vote for our motion today.
And do you intend to get the vaccine as soon as you are eligible?
Thanks, Lee. I've said many times that I intend to get the vaccine, and my family as well, in the priority indicated by a national plan. And I got the flu vaccination. Our family did this fall. That was important. My family has also been through the isolation and uncertainty with respect to COVID. So let me be perfectly clear. The vaccine is critical. It's a critical tool. I trust our health care system to make sure it's effective and safe for use. This is why Mr. Trudeau needs to show Canadians we have a plan. Here's the plan in terms of how we're going to use the vaccine, when you're likely going to get it, how we're going to store it to make sure it's effective for use, and the clinical work that's gone behind the safe and effective deployment of the vaccine. Information is critical in the pandemic, and that's why the secretive closed-door approach of the Trudeau government is causing more questions than providing certainty.